Falls lead to reduced quality of life, reduced mobility, increased risk of being placed in a nursing home, and many other quality of life consequences for the older adults who fall. So it is very important that we do everything in our power to help our older patients reduce their risk of falling.
Screening for falls was not something that our clinic did prior to beginning the STEADI project, and it was very important that we figured out a way that dovetailed with a lot of the other efforts that we were already doing in clinic. One of the ways that we started thinking about doing a fall screen on a routine basis was to add it to someone's chart, just like you would add an annual flu vaccine to someone's charts. We developed a falls risk indicator so that when a fall screening was due for someone 65 and older, it would trigger on their chart and the provider and the other clinic staff would know that a fall screen was due. It was important for us to pilot the STEADI protocol before we rolled it out to the clinic at large. We did this by having a few providers, all of us in geriatrics in particular, use the various electronic health record tools and the workflow to test it out and to find where we needed to improve some of the systems. If another clinic or healthcare system wants to use STEADI, I would encourage them to collect information about what will work with their current workflow process as well as their electronic health record. It's really important to take clinicians and clinic staff where they are currently practicing, and then tailor workflows and tools to those systems and processes.
STEADI has impacted our practice in a number of ways. I think that it's helped to enhance teamwork in the clinic because staff and providers are really working together to make STEADI a success. And patients love STEADI. They really feel that it means their providers and their team are paying attention to their risk for falls and giving them some tangible things that they can do to reduce their risk of falls. So I think it's made a big difference. I had an elderly gentleman who I didn't know he was at increased risk of falls, and he didn't know he was at increased risk of falls, but he scored high on his STEADI falls risk assessment. So we looked at his medications and were able to stop a couple that were increasing his risk of falls. In addition, he told me that he had been afraid of falling, and I was able to have him do a PT gait and balance evaluation to learn an exercise program that would make him have less fear of falling. Both of these things allowed him to get back out into the community and do more of the things that he loved to do.